The title of our presentation is Malaria, Still a Burden. Malaria is caused by parasites that are transmitted through the bites of infected female Anopheles mosquitoes. Approximately 3.2 billion people, nearly half of the world's population, are at risk of malaria. In 2015 alone, there were 214 million new cases and 438,000 deaths. Although there has been a remarkable decline in the global malaria burden over the last 15 years, the journey is far from over. World Health Organization officially recognizes malaria as a life-threatening disease. The symptoms include high fever, chills, vomiting, and even death. Millions of people around the world are still not able to access the health services they need to prevent and treat malaria. As of 2015, 95 countries had ongoing malaria transmission. There are currently no effective vaccines against malaria or any other human parasites. In recent years, parasite resistance to anti-malarial drugs has been detected in many countries. Through careful planning, malaria can be prevented and treated. Now, sub-Saharan Africa carries a disproportionately high share of the global malaria burden. In 2015, the region was home to 90% of malaria deaths. So what makes sub-Saharan Africa so prone to malaria? Mosquitoes thrive in regions with warm temperatures, humid conditions, and high rainfall. Malaria has a heavy economic burden on the region, with 90% of deaths afflicting primarily the poor who tend to live in malaria-prone rural areas in poorly constructed dwellings that offer few, if any, barriers against mosquitoes. Inequity in access to healthcare is a significant issue as well. There is also a shortage of healthcare professionals in this region. In fact, Africa has only 2 healthcare workers per 1,000 people, whereas America has 25. Now, Canada has the potential to provide donors and volunteers that could potentially raise funds for these non-profit organizations aimed at supporting the people living in sub-Saharan Africa. Many diseases have been eradicated by the help of researchers and their findings. Malaria is no exception. Canada has well-known research institutions that could turn their attention to malaria. Recent research has focused on creating genetically engineered mosquitoes to eradicate this life-threatening disease. As for our target audience, we intend to educate the affected population in sub-Saharan Africa about prevention and treatment for malaria. Our project is also focused on assisting non-profit organizations that are dedicated to fight malaria. Furthermore, we need the assistance of people in our communities, cities, and country to come together and help with the burden of malaria as a whole.
As stated before, there is a major funding deficit that is slowing down the battle against malaria. We have set up a GoFundMe page to help raise funds for the non-profit organizations who will be directly supporting the young children and pregnant women in this region. Through funding, these organizations will be able to provide insecticide-treated beds and indoor residual spraying free of charge. Moreover, we intend to publish an article in a local newspaper such as the Vancouver Sun or 24 Hours to encourage the general public to get involved through donations and volunteering programs that assist with the battle against malaria directly and indirectly. Once funds have been raised, where should the money go? We believe there should be an emphasis on providing education to the general public, specifically focusing on children and women as they are the most affected by malaria. This can be done by providing educational materials such as pamphlets. We have created a petition to capture our government's attention and help the Canadian government see this as the big problem that it is. Our last intervention would be to address the shortage of doctors and healthcare workers in the sub-Saharan area. We want to send a letter to the Minister of Health, Jane Philpott, to propose changes in how Canadian medical students and graduated physicians can be incentivized to help people in the sub-Saharan Africa. One way to do this would be by giving students course credit and having their electives satisfied by practicing in sub-Saharan Africa. In addition, we could fully fund trips for doctors and healthcare professionals to that area. We want to suggest tax cuts for doctors who have served in Doctors Without Borders in hopes to increase medical students to go help out as well. Finally, in our letter to the Minister, we wish to emphasize the importance of increasing the funding on parasite-related research that could lead to discovery of potent medication and vaccines. Through these interventions, we hope to bring the global community closer than ever before to our common vision of a malaria-free world. Thank you.